If you're over 60 and you've noticed changes, getting up twice, 3 times a night to urinate, a weak stream, that feeling that you never quite fully emptied, you're not imagining it, and you're not alone. By age 60, more than 50% of men have measurable prostate enlargement. By 70, that number climbs to 70%. By 80, it's nearly 90. The medical term is benign prostatic hyperplasia, BPH. And while doctors call it benign, the quality of life it destroys is anything but. But here's what most men don't understand. The same biological processes that cause your prostate to enlarge are the same ones that increase your cancer risk. They're connected. And that means addressing them at the root, at the cellular level, addresses both problems at the same time. That's exactly what this morning habit does. And it does it through 3 distinct pathways that most men have never heard explained. Mechanism 1, DHT suppression via 5-alpha reductase inhibition. DHT, dihydrotestosterone, is the primary hormonal driver of prostate growth. It's not testosterone itself that causes your prostate to enlarge. It's what testosterone converts into. Your body uses an enzyme called 5-alpha reductase to convert testosterone into DHT. DHT is roughly 5 times more potent than testosterone at binding to prostate receptors. And when it does, it signals prostate cells to grow. This is why the most prescribed drugs for BPH, finasteride, dutasteride, work the way they do. They block 5-alpha reductase. They reduce DHT. The prostate stops getting the growth signal. But those drugs come with a cost: sexual dysfunction, depression, in some cases, permanent hormonal disruption. The FDA even added a warning about potential increased cancer risk from certain types of prostate cancer. Here's what the research shows. Lycopene, the compound we're talking about today, inhibits 5-alpha reductase activity naturally. A 2011 study published in the Journal of Nutritional Biochemistry demonstrated that lycopene directly reduces 5-alpha reductase enzyme activity in prostate tissue. That means your body produces less DHT. That means less hormonal signaling for prostate cells to divide and grow. No prescription, no side effects, just a reduction in the hormone that's been quietly telling your prostate to expand for the last 20 years. Mechanism 2, NF-κB suppression. Inflammation is not just a symptom of prostate problems, it is a cause. Inside your prostate right now, there is a protein complex called NF-κB, nuclear factor kappa B. Think of it as an inflammation switch. When NF-κB is activated, it triggers a cascade of inflammatory cytokines that damage prostate tissue, promote abnormal cell growth, and accelerate the progression from BPH to cancer. Chronic low-grade inflammation in the prostate is now considered one of the primary drivers of prostate cancer development. This isn't fringe science. This is the consensus position of the American Urological Association. And lycopene is one of the most potent natural NF-κB inhibitors ever studied. A 2014 study in Cancer Prevention Research showed that lycopene supplementation significantly suppressed NF-κB activation in prostate cells. The inflammatory cascade was interrupted. Cell proliferation slowed. In animal models, tumor growth was measurably reduced. What does this mean for you? Every morning you use this protocol, you are turning down the inflammation switch in your prostate. You are reducing the chronic cellular stress that accumulates over decades and eventually tips normal cells toward malignancy. This is not maintenance. This is active protection. Mechanism 3, reactive oxygen species neutralization. Your prostate cells are under constant oxidative attack. Every day, normal metabolic processes generate reactive oxygen species. unstable molecules that damage cell membranes, disrupt protein function, and most critically, break DNA strands. DNA strand breaks are the precursor to mutations. Mutations are the precursor to cancer. Men with the highest levels of oxidative stress in their prostate tissue have the highest rates of prostate cancer. This is not correlation. Mechanistic studies have established the direct pathway. Lycopene is one of the most powerful antioxidants found in the human diet. It has a singlet oxygen quenching rate more than twice that of beta-carotene and more than 10 times that of alpha-tocopherol, what you know as vitamin E. A landmark study from the Harvard School of Public Health, the Health Professionals Follow-Up Study, tracked nearly 50,000 men over 6 years. Men who consumed the highest amounts of lycopene had a 44% reduction in prostate cancer risk compared to those who consumed the least. 44%. Not 3%, not 10%, 44%. And the primary food source that drove that reduction was not lycopene supplements. It was cooked tomatoes, specifically tomato paste. Because here's the part most people miss. Lycopene is fat-soluble and heat-activated. Raw tomatoes deliver some lycopene. Cooked tomatoes, especially in a concentrated paste, deliver up to 10 times more bioavailable lycopene than raw. And consuming it with a small amount of healthy fat increases absorption by another 30 to 40%. So here is the exact morning protocol. 1 tablespoon of tomato paste, not tomato sauce, not ketchup, not salsa, pure tomato paste. 1 tablespoon contains approximately 15 milligrams of highly concentrated lycopene. Add it to 1 tablespoon of olive oil. The fat is not optional. Without it, your gut absorbs only a fraction of the available lycopene. The olive oil also adds its own anti-inflammatory compounds, which work synergistically with the lycopene. Consume this in the morning, within 30 minutes of your first meal. Early consumption allows lycopene to circulate during your highest metabolic window. That's it. 1 tablespoon. 1 tablespoon. Every morning. The clinical studies showing the 44% cancer risk reduction used a daily dose of approximately 15 to 30 milligrams of bioavailable lycopene. 1 tablespoon of tomato paste with olive oil puts you precisely in that range. What to expect on the timeline. Week 1 to 2. No dramatic changes. Lycopene is accumulating in prostate tissue. This is a slow building compound, not an overnight fix. Week 3 to 4. Some men begin noticing slightly reduced urgency and improved sleep continuity. This varies. Week 6 to 8. Studies show measurable changes in prostate-specific antigen levels and inflammatory markers at this stage. If you're having labs done, this is when you may start seeing numbers shift. Month 3 and beyond. This is where the compounding effect matters. Consistent daily lycopene intake over 3 months produces statistically significant changes in prostate tissue inflammation and DHT-driven growth signaling. Safety note. Lycopene from whole food sources has no documented toxicity at any level studied. If you're currently on alpha blockers, 5-alpha reductase inhibitors, or any prostate medication, continue them. This is not a replacement for your medical protocol. This is an addition to it. If you have a history of prostate cancer or are in active monitoring, discuss this with your urologist before starting. If this video gave you something your last doctor's appointment didn't, share it. 1 tablespoon every morning. The research is there. See you in the next one.